Hello, and thank you for coming to this presentation, Obesity Among Hispanic Women in Los Angeles County, a Community Needs Assessment. Welcome, my name is Amy Esposito. I'm a candidate for a Master's of Applied Nutrition from the University of New England. I also hold a Bachelor's of Nutrition Science. I also work at the Providence Little Company of Mary Medical Center as an outpatient dietitian, and also I've done clinical work for another group. My work as a community health educator has been on hold since the pandemic, but I've provided health education to the community and local high schools. My interest in this topic started years ago with my work in the hospital, and as I gained working relationships with the Hispanic population, learning conversational Spanish, my care and interest in this population deepened. So the topics I'd like to cover today are obesity effects on women in Los Angeles County, the obesity risk and related causes, the women of Council District 15, San Pedro, also just a very brief review and interpretation of the data, and then addressing some unmet needs and a proposal for an intervention here. So many of us are well aware that obesity's prevalence is very high in the United States. It affects 42.4% of the population. And we know that the related health conditions are linked to heart disease, stroke, type 2 diabetes, and some cancers. Also, the healthcare costs for treating obesity-related conditions in the United States was $1.72 trillion in 2016. And it's important to note here that these are pre-pandemic numbers. This number also represents 47% of the total healthcare cost to treat acute on top of chronic diseases, the diet and lifestyle related diseases as mentioned. Also, we know obesity is a risk factor for COVID-19 and can increase the severity of infection. So for our population of Hispanics in the U.S., it's important to note that 18.5% of the U.S. population is made up of Hispanics. And this represents the largest ethnic and race minority in the country. And Hispanic is an umbrella term for people that come from the countries of Mexico, Central, South America, all the countries that are listed within that, and some European countries as well, such as Spain. Most of the population of LA County, the percentages are higher in that refer to themselves as Mexicans. Also, 48% of the population of Los Angeles County are Hispanics, and nearly 30% of those are obese. And women, which is our focus here today, make up half of those numbers. So over 2.5 trillion, if you take 30% of that, you can see that that number is very high. And women carry a higher burden of disease for obesity. And then in San Pedro, the city of focus here, Hispanics make up about 46% of the population, which is similar to LA County. So we know that nutrition is very important in the fight against obesity and developing obesity. However, we look at individuals from a more holistic view, or what we call the social determinants of health. And it's based on these factors: economic stability, are there jobs available for people? Do they have access to quality education and health care? Are their neighborhoods conducive to walkability? What does the food landscape look like? Are there a high proportion of fast foods and convenience foods available? And also the safety. Then the last two here, social and community context. That refers to racism and violence. And the COVID-19 pandemic has revealed not only that in our neighborhoods, but also in the healthcare system, that there's a wide disparities for racial and ethnic in both the Hispanic communities and Black communities as the top two. A brief closer look at obesity here. It may help to know that obesity was classified as a disease by the American Association of Endocrinologists back in 2012, and it is associated with the impairment of both mechanical body functions and cardiometabolic complications. So what that does is it puts a person at higher risk for developing metabolic syndrome, prediabetes, non-alcoholic fatty liver disease, and cardiovascular disease, unfortunately. So we would like to avoid that. So, but we're not out of the woods yet. COVID-19 has presented us with more to perhaps to deal with, and when it comes to obesity, again, it is a risk factor for COVID-19 infections, and unfortunately Hispanics accounted for almost 33% of the cases in the United States, and this was at the height of the pandemic. They have also suffered the highest morbidity and mortality rates here in LA County, and unfortunately of the approximately 24,000 deaths due to COVID-19, in LA County, Hispanics are experienced over 3 times the rate compared to their white counterparts for morbidity and mortality. So that's an issue here. In the most recent report we have from our local health department on District 15, which is the city of San Pedro, it highlights these social determinants of health. And the report details, I've highlighted a few here, the average life expectancy is less than 6.3 years. And this is pretty drastic compared to other communities. And there's a lot of factors here in this community that go beyond the social determinants of health, or rather beyond the scope of nutrition. But it is important also to note that 25% of the residents live below 100% below the federal poverty line, and almost 50% of the residents live 200% below. And the obesity rates are similar to those of LA County for adults, and 13% are diagnosed with diabetes, and those are just the ones that have been diagnosed. The residents have also reported 30% of them have food insecurity, and we know for a fact that the studies have shown that people that are in poverty and food insecure, they are at higher risk for obesity. So how do we help our residents? Los Angeles County Department of Public Health maintains a very robust nutrition and physical activity division. They have a vision and a mission to provide an environment of support and health promotion so children and adults can enjoy nutritious foods along with being active. Their mission is more active in nature. They advance good nutrition practices and physical activity both through education for all persons of LA County. They do have several programs that I've highlighted here that are available throughout the county. The state version of the federal SNAP, which is the CalFresh Healthy Living. Women, infants, and children, which we maintain a local office here in the San Pedro area. And also a little bit newer in the last year is a produce prescription project, which is tied to the above two programs, in which those that qualify for those programs can receive vouchers for local farmers markets, so they may get fresh produce. One interesting feature of the Nutrition and Physical Activity Division is they maintain a coalition called the Nutrition Access LA, and I had a recent conversation with a key informant who discussed some of the difficulties right now with COVID, and still some businesses, including the LA County, people are working from home. So a lot of the programs that they do in the education in the community has been closed down for right now. So the focus really, as I was told, it is on community safety, and I see this in my own hospital with community health workers that I work with, and also social workers. That's one of the reasons why this presentation is so heavy in the social determinants of health, because we're understanding more and more the weight of it. So just very briefly, some analysis and interpretation of data. Cultural sensitivity is at top of mind. Hispanic is a global term really for Latinos and people that have a rich cultural heritage, and they come from areas of Mexico, Central and South America, and some areas in Europe. There's a recent study that's been done. Many of us have heard of food stamps, but food swamps are now replacing food stamps, and that means that there's just a higher concentration of a lot of convenience and fast foods that are not health promoting. I want to move forward very quickly here. The proposal that I am addressing the unmet needs here will be through a proposal to expand WIC education to include training for promotores, community health workers. These are people that live in the community. And my discussion with the key informant from the LA County Public Health Nutrition Division, we talked about possible collaboration efforts. And because a lot of us, the staff, both her staff and my staff, a lot of us are dietitians, and we use a lot of the same basic nutrition principles that we could teach these promotores, and we can utilize existing staff. So we can promote this in a variety of ways, but the effort really is to collaborate with area hospitals and health clinics along with WIC to raise awareness around obesity. Thank you very much for attending.